We begin with breaking developments. Germany is the latest to join a growing number of countries to suspend the rollout of the AstraZeneca COVID-19 vaccine over safety fears. Bulgaria, Denmark, Ireland, the Netherlands, Norway and Iceland have stopped giving the shot following reports of an increased risk of blood clots. But AstraZeneca and the World Health Organization insist there's no risk. The move comes after a leading German lawmaker called on the authorities to issue clear guidance on whether the vaccine is, quote, good or bad. All right, let's get you more now. I'm joined by Stergios Moschos. He is a virologist and associate professor at the Northumbria University in the UK. A very good day, sir. Now, I'd like to get your reaction to these latest developments. AstraZeneca, as you know, insisting there's just simply no evidence that its vaccine causes increased risk of blood clots. Yet a number of countries, most likely Northern European countries, have suspended the use of the vaccine.
Yeah, so I think we must say, first of all, that it's extremely important when situations like these arise to take them very seriously and have a look at the data very carefully before jumping to conclusions. We've come into this pandemic through decades of people listening to conspiracy theories around the risks of vaccines with regards to other diseases. So any kind of wrong message, it's actually going to be very impactful, especially in an effort to try and push back against this pandemic. So it's really, really important that we give clear, concise and carefully thought out messages. So in that respect, I fully support the decision of any lawmaker to stop, have a look and take into consideration the data. Now, on that data, what we know is that 17 million people have received this vaccine and 37 people have developed these blood clots. That corresponds to 0.0002% of actually anybody that has been vaccinated getting a blood clot. And you would probably agree with me that the risk of getting a blood clot is actually 100 times, if not more, less than the risk of actually dying from coronavirus if you get it. Therefore, to basically be afraid of something that may happen because of the vaccine, in order to protect yourself from something else that can be much more harmful to you, that alone should be decided to people whether or not they should take the vaccine.
But of course,
from another perspective, the question is...
Sorry, sir, for interrupting you, because we have very limited time together, and I'd like to get as many answers from you as possible. You know, obviously, yes, the chance is very slim that one will get blood clots, but if you happen to be that one person, have that bad luck, that is, of course, not ideal. In terms of AstraZeneca,
Absolutely.
It's been bogged by trust issues, not so much in its vaccine, but in terms of the deal that kind of went wayward with the EU. You know, what can AstraZeneca do at this stage to restore confidence in its product?
Look, I don't work for the public relations department of AstraZeneca. I'm here as a scientist to express my opinion, my learned opinion about the risk that's presented by this vaccine. And I'm going to put it this way. If somebody came to me through the door right now and said to me, here's the vaccine, will you take it? I would say, yes, please, because I'm on the queue to come in to get the vaccine at the end of April, and that's too far away as far as I'm concerned. I would take it straight away. I would even give it to my 4-year-old child, even though this has not been tested on children. This is how confident I feel personally about the risk presented by these so-called blood clots. Blood clots happen in the population randomly. There's a specific number out there that you can look up with regards to the frequency of blood clots in the general population. People that have received the vaccine seem to be twice less likely to get the blood clots overall. So from that perspective, there is no risk. We really need to make that abundantly clear.
You're joining us, sir, from the UK, where, as I understand, AstraZeneca is widely used. Share with us some of the experience that the UK has had with this particular inoculation.
What can I say? Obviously, many people would have preferred to receive one of the vaccines that have a generally slightly higher percentage of efficacy, but it still is a very efficacious vaccine. We have other vaccines that have been approved and in use for decades that are nowhere near as efficacious as this vaccine. And as a result of that, there should be no concerns and no hesitancy about receiving the AstraZeneca vaccine. The only individuals that should be a bit more careful are the people with very strong allergies. And this is just something general for all medications. I'm sure last time you went to the doctors and they gave you a prescription, they asked you, are you allergic to anything? So if you are allergic to something, you need to tell the doctor before you get any vaccine, not just this vaccine or the mRNA vaccines. It's actually important that we think about the common good here and how we can work as individuals to support society and the economy in general.
All right, Stergios Morshos, virologist and associate professor at Northumbria University in the UK and molecular biologist. Thank you for sharing your expertise with us.
You're very welcome.
All right, let's get some other developments now on the pandemic. The developers of Russia's Sputnik V vaccine, say companies in Germany, France, Italy, and Spain, have agreed to help produce the jab. It hasn't officially been approved in the EU yet, though. Meanwhile, ICU doctors here in Germany are urging an immediate return to a partial lockdown because of COVID-19 mutations. Germany has seen a rise in infections since gradually easing measures late last month. And half of Italy's regions have gone into a strict lockdown. It's because of a new spike in coronavirus infections. Authorities say hospital admissions are beyond manageable.